So now the living will is just a document. A process and a system is needed to make it effect. So the process and system, I spoke to you how to make it, who should be on your behalf, and all those things. And then it is in death literacy. This system is called advanced care planning, a process to guide decision making about your own healthcare if and when you don't have the capacity to decide for yourself. So when you have lost the capacity, that is when the advanced care planning will come into place. So advanced care planning has two components. One is proxy decision maker on your behalf. We call them as power of attorney. Then the next is guidance. So, if possible, think of three people who can accept the responsibility and available for you. So you can write it like who should take your decision on your behalf. You should take as first decision maker, second decision maker, and third decision maker. So when you think of it, you see that there are three decision makers, and again, all three decision makers should align to oneself. That is very difficult thing. So generally at this point, so if the first decision, this decision maker is, because once the first decision maker is not there, then you go to the second decision maker or third decision maker. But if the first decision maker is available, he can take the complete responsibility and he will be on your behalf. But remember, this is not any community or anything like that. They can talk to each other, but only one person should decide. So the next decision is, where should we pass during the end of life? Is it a hospital, home, setting? So if you see in hospitals, when they want to pass away, they generally move. No hospital takes them in a ward or in a room. They move them to an acute care setting like an ICU. If you see ICU, there are lights which are constantly on, continuous masks, continuous noises will be there, strange people. You don't know all the people inside the ICU. There are a lot of, generally if you see the ICU setups in India, there are 10 to 12 people in one room with lot of nursing staff supporting them, wearing the masks and doing some sort of painful procedures like IV lines and all those things. So do you have the right to refuse your life-saving treatments? Definitely you have your, as an autonomy, you can do whatever you want. In many patients, they do save life, but in many others, they only prolong the dying process. So, life-saving treatments will generally prolong. In ICU, if you see your rates are high, so it will help only to prolong the dying process, like IV fluids, artificial tube feeding, dialysis, ventilator. These are normal procedures that they do in ICU, and these will prolong the dying process. But how well they, out of 10%, 10 people, only 1% of the people will recover from this. But what is the quality of life they have? These are all the chronic health related sufferings. So now you don't want to be in an ICU. Then next, where it is and what is it going to happen? So you have in hospitals, either in medical ICUs or a hospital wards. Then you have something called extended care facilities. The new concept like assisted living and hospices. Hospices are the places where your last stages with near and dear ones can happen, but there are again few restrictions that a lot of people will be not be there available at that point of time. It's up to you to make the decision. So the next thing is it possible to pass away comfortably at home? Definitely yes. But considering the present family dynamics and scenarios of the present generation of people, it is really difficult to do that. Yes, you can do it at home, but generally, practically, if you think who will do it at home when you are having any suffering and wanted to do anything. So the thing is, who will do this seva at home now? So one, generally in India, as it's not discriminating something, it is sons and the daughters. Generally, the daughters will be the one who provides care. So the breadwinner of the family will go out of three daughters, one will lose the future. They have to spend together with the family members, stay with them, be those things. The present, that is where the assisted living facilities or hospice facilities have come into place right now. So the next thing is, what is the cost you have to provide by doing it at home? In US, it will be like $70,000 to $100,000 per year in an extended care facility. In India, it will cost you around like 6 to 12 lakhs per year at home alone when you want to have a doctor to come on a regular basis to visit you, the nursing care. If you leave your job or anything like that, that is also a part of this calculation. So these are all the practically difficult things what we experience, and the patient family members, patient son, children, or someone comes to us and generally tell on any point of time. So the prognosis also we can't tell. So it can be like 5 years, 6 years. If you see a memory loss or dementia patients and all those things, the duration can be like 10 plus years. It can be 15 years and all those things. So now the living will is just a document. A process and a system is needed to make it effect. So the process and system, I spoke to you how to make it, who should make it, who should be on your behalf, and all those things. And then it is in death literacy. This system is called advanced care planning, a process to guide decision making about your own healthcare if and when you don't have the capacity to decide for yourself. So when you have lost the capacity, that is when the advanced care planning will come into place. So advanced care planning has two components. One is proxy decision maker on your behalf. We call them as power of attorney. Then the next is guidance. So what type of life you should have, you mentioned in that advanced directive. What level of care you're expecting. Some people wanted only the medicine, they don't wanted procedures like tubes and all those things. What is your hope in face of illness? And then all this comes and you should document it in a living will. So how to do an advanced care planning? So as a person, how you should do your advanced planning? You should think you wanted that. You should discuss with your family members. So they are the ones who are in the next stage. Once we are sick, our family member takes on our behalf. So then we go to an hospital like healthcare, like a doctor and all. So you should discuss with everyone has one family physician. We should discuss with them how you wanted your life to be and how you wanted to pass during the end stage of life. Next is you have a counselor. You can have a counseling session like what are the pros and cons of this and what it is and all those things. Next, you should include in your medical records that you have an advanced care planning in place. So the new doctor or the next doctor who is there, when you are on an emergency, who are coming to an hospital of that particular thing. So if it is documented in a medical records, so advanced care planning will be there. So advanced care planning is a system to see that is acted upon. How is ACP, advanced care planning, used? If and when you lack capacity to take your decision, living will advanced directive wills can provide guidance for your surrogate healthcare power of attorney to your family, your healthcare providers and doctors. So advanced care planning can be used for all those things. So the Supreme Court has authorized us to appoint a surrogate decision maker as a part of advanced medical directives. So when to make an advanced directive will or a living will is when you have a new serious health related suffering. That is when you can start thinking of your advanced directives. When you have repeated hospitalizations for one particular scenario, and when you have a change in your care needs, whenever your mind tells that no, this is the end, like how I want it to be, and all those things. The next thing is any point, any time in your life it can happen. It always seems to be too soon until it is not late. So always think of it and plan accordingly. So the next thing is you can have it out. I have written an advanced directives. Next thing is when I go to a hospital, they won't do anything. The medicine has evolved in such a way that like 6 months back, you think when there is no treatment, now there is a treatment for that. So at that point of time, you can revoke your advanced directives at any point of time instantly orally. So you can just tell it as, I don't want this advanced directives. You can change it. You can give a new advanced directives. You can discard the old one. There is no legal system in anything in this. You can just go get that paper removed and have another. So I want everyone who has listened to this to think about advanced directives, how they wanted their life to be. So it will be beneficial for their planning and it will be useful as a decision maker for their children and all those things. So your systems will be clear, all those things will be clear. Thank you.
Lakshmi Narayan Garu, will you ask your question?
Yeah, good morning, sir.
Good morning.
Yeah, it's a very good initiative, definitely. And I'm a qualified rehabilitation by the Rehabilitation Council of India. But I'm well connected with welfare or dignity of senior citizens as well as the persons with disabilities.
Okay.
I got 2 points to get a clarification from you, sir.
Okay.
Initiative is very good because in disability also we are trying to get a better solution with the support of a government and NGOs, that every parent is having a concern that what will happen to the child after.
Yeah.
We are also trying for a life care center with the legal security, financial security, including social also, like an inclusive community to be developed. Now, my concern, because of my 2 years experience meeting with the people of both affordable or poor people, point is, sir, for the poor people and the one who are living in the slums, availability of such information, accessing them, and affordability is the biggest challenge, sir.
Yeah.
That's the one, sir. Now, I'll go for the second point also. Suppose if it is an affordable group, they have got money, they're getting a lot of pension, their property, that everything is there. But in view of this globalization or modernization, the mad rush is of the youth moving from their own places to different parts of the globe, leaving the parents almost isolated. Because my concern, I am in Hyderabad only. I am visiting number of old age homes and some families also, part of my services. See, the children are not there, they are quite away, and they may be having money, having a house also, but mostly they are at the mercy of the caregiver, which is sometimes legally protected, but other times they're all worrying that no one is there around them. So more of a social or emotional issues are burning for them in spite of having a money and living in the hands of caregivers, because just recently for a family who are health issues are there, and the 2 sons and a daughter, they were not near to them, not ready to take care. So because he is getting a pension of 80,000 rupees per month, they have appointed one caregiver at a cost of 20,000 rupees. So he will be doing everything. So affordability, because now it has become a biggest business in Hyderabad. The old age homes or whatever you call it, costly, varies from almost free to 60,000 rupees per month per head. That's there in the Hyderabad. Of course, who can afford, they always say that, yeah, we have got money, we want to enjoy, relax and enjoy when our children are not taking care of it. But still, though the NGOs are running the old age home, still the government role is much less on them control. It is all misusing the resources or maybe the lives itself. When you talk about the dignity, equality, quality of life, still, though we have got an act for parents' protection of the living, and they have got a provisions also. Every district should have one old age home under the control of a government. Supervision or the evaluation monitoring part, sir, that is more concern, sir. And because though they are providing, dedicated NGOs are providing services, but above them, there is no control. But are paying 40,000, 50,000 per month also. What happens there, nobody knows. And children are not bothered even for the last rites also. Maybe government should come out with a more active role in a monitoring on a regular basis, because now the digital technology is available. Monitoring is not going to be. This is just only 2 points I want to just say.
Yes, see, for the last 25 years, there is no reforms that had happened for senior citizens.
Yes.
Now, like 3 months back, the government of India has created a new guidelines for senior reforms, because there are a lot of assisted livings that are coming up and all those things. Exactly. So again, here, when there is an advanced directive in place, it need not be the children or anything. If I write an advanced directive, that is the major chunk of population who write their advanced directives, they can go according to that. If you have your advanced directives, if you come to me with a doctor and this is advanced directives, if I feel this is a serious health related suffering, we have to continue without his wishes, we can go ahead. There is no legal system involved in this. We can just go with that system. I think over the next 1 year or so, the social reforms for senior citizens will definitely have a lot of change and all those things.
Okay, sir. Thank you, sir.
Yeah, I'm Subramania Prasad Swarupaneni andi. Yeah, very good morning, Dr. Moody garu. It was
good morning.
It's nice listening to you. And yeah, I think So first and foremost, let me tell you, I am one of those who have been associated because of my mother was actually admitted. I brought my mother to the Sparsh Hospice, September 22. She breathed the last there. And let me say that overall, she was at AAG for a month, diagnosed with peritoneal cancer. And I must say that I do not regret, we do not regret having brought my mother to the Sparsh Hospice. I think that statement of mine speaks a lot. So it was a very, I would say, a positive experience. And I think she was there for about, 5 days or something like that. So now with that familiarity and acquaintance, and after having heard you about your advanced directive, this thing which I was not knowing earlier, since your hospice has got medical professionals and also a counselor there, the right people, can we come to you with a request to help us in making the advanced directive? And secondly, probably the other thing is the legal sanction also. Now, are you saying that in our country there is legal sanction for this is required? If so, is it easy to get it done? So two things. One is I'm suggesting that your hospice can help us in getting through our directive, and secondly also getting it that legal thing. And since you mentioned you said power of attorney. I mean, is it going to be something like a document which has to be authenticated by a legal person? What is it like?
Okay. So to your first question, my answer is we are always open. You can come at any point of time to Sparsh and we are there to support you. And within the next the legal system has changed now from 2018 to 2023. So even we are trying to come up with an advanced directive clinic at Sparsh Hospice soon. So even before that, you can walk in anytime. We are always there to help you to prepare the document. And it is just a 100 rupees legal paper which you need to sign it. And you can tell can take the decision on your behalf of that. So the next question, the second one is, there is a power of attorney in the sense, once you start giving your autonomy, like my decisions should be taken on my behalf if I'm not competent enough to tell it to this particular person. So we'll take his decisions and we'll follow accordingly. There is no legal system it was there in 2018, but 2023, the legal system has changed. On one piece of paper, if you sign it and give it, that is done. So power of attorney generally comes for withholding and withdrawing treatment. So suppose one of your family member is admitted to a hospital without any advanced directives. Then before that, it used to be in the law, we should go to the court and do it. But now there is a primary board and secondary board constituted by the hospital. They have the full decision-making capacity to take the decision from withholding and withdrawing the care of that particular person when there is no advanced directive. This plays only when there is no advanced directives.
Oh, that means once advanced directive is made, let's say with your help, that can be submitted with you and that's it. There's no need
to do anything. Yeah, just the local panchayati office in which you are staying, that's all. For the legality purpose, other thing you can submit to us then.
Okay, thank you. Wonderful. What is the difference between emotional pain and
emotional pain is, we generally have, if you as you said, your mom had a cancer, she was having an emotional thing. Why it happened to me? Did I commit any mistakes in my life? So that is the reason they're emotionally suffering with that sort of pain in their things. So the social pain is, they think that because of me, my children have work, they're coming, taking care of me. Those are all the psychological, and their family members will also think, how is my daughter coping up with this? That is also a sort of pain for them, right? So this is what emotional pain and social pain.
More or less both are
interlinked words. Psychosocial model, we call them.
Yeah. Thank you so much. Thank you.
Emotional manakunna kashtamu, psychosocial pedutunnama.
Yeah, it is like that.
Those kind of social pressures which are unnecessary. Sometimes people are earning 20,000 a month and they're taking loans of 10-20 lakhs for their parents, and for the next 20 years they're going into loans. So this is a very, Guru has brought in a very, 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 very important discussion onto the table and said that now with the Supreme Court directive, it is possible. This is the need of the hour. The awareness should be spread and implemented first within our own families. At least each of us should take 100 families where we can get this implemented. With our own parents, with our own siblings, with our own children, we should get this done. Yeah. Thank you for your questions, Andy. Very pertinent and useful. Okay. Next question. What are the books that you would suggest? Like there is a book for living and dying in the Buddhism books. Have you heard of that? Are there any such books that you would recommend for people who should prepare for death, so that when people leave this abode, they leave complete about their life.
Yeah, there is a book written by Sadhguru, The Death. Book name itself is The Death. So it creates how the process of life and all those things are there. The book depicts from starting to ending how the process of our human soul. So each religion, if you're talking about, like, there is individual religion has a different things. Why do we cremate at after the life ends? What is the reason for doing cremation? What is the reason for burying? What is the reason for doing? Each religion has that. That book clearly tells how it is with a lot of evidence in place.
Do we also have books where how to grieve when the near one leaves?
So there are books for grief pain basically. So, but again, not all books will tell you. It gives you an idea how it is. As per the psychology, what happens is during the process of grieving, you should have someone to support us in that grieving. It is not you individually can't grieve for yourself. These are all the emotional and psychological factors. So when someone is passing away, when you're alone crying, it is different. When someone is there next to you, you start spreading the word of things like that. So I always feel more than books, we should have someone, a companion to be with us, whom we can grieve and all those things. We read a lot of books for psychological mind, dignity, therapies and all those things. But you start interacting with like-minded people of yourself. So now you see there are a lot of gated communities that are in place. All the senior people at the end of the day or evening, sometimes they just go for a walk. After 5-6 days, they get used to that. It is not, they can't sit and read at home. It is not like that. They understand what it is and all those things. So I think more than books or something like that, always a companion or someone to be around with them will be more helpful. And the books can always be a guiding path for all those things. So grief books, there are a lot of books that are there now.